extradural, intradural, extramedullary and intramedullary lesions. So spinal cord lesions are classified according to their anatomical location into three major groups: extradural, intradural extramedullary and intramedullary lesions. So understanding these locations, this helps narrow the differential diagnosis and predict clinical presentation. Extradural lesions, they are located outside the dura mater, usually within the epidural space or vertebral column. So these extradural lesions are located outside the dura mater, usually in the epidural space or vertebral column. Since they compress the spinal cord from outside, symptoms often develop rapidly. So what are the common causes of extradural lesions? Epidural hematoma, epidural abscess, vertebral metastasis involving the vertebral body, intervertebral disc prolapse. So because these lesions compress the spinal cord from outside, how does the symptoms develop? They develop rapidly. So they present with acute or subacute onset, severe back pain, and there will be early bladder involvement and rapidly progressive neurological deficits. Then coming to intradural extramedullary lesion. So these lesions are inside the dura but outside the spinal cord. So they compress the cord gradually, resulting in a slower progression of symptoms. So what are the common causes? These include meningioma, nerve sheath tumors such as schwannoma and neurofibroma, epidermoid or dermoid cyst and metastatic tumors. So what are the common causes of intradural extramedullary lesion? Meningioma, nerve sheath tumors such as schwannoma and neurofibroma, epidermoid or dermoid cyst and metastatic tumors. So what are the clinical features? Insidious onset, back pain with radicular pain, late motor weakness, bladder involvement occurring later in the disease. So intradural extramedullary, bladder involvement is late, motor weakness is also late, there will be a back pain with radicular pain and it is insidious onset. So a characteristic finding is a well-defined sensory level. Then coming to intramedullary lesions or medullary lesions. Intramedullary lesions arise within the spinal cord itself. So what are the common causes? Astrocytoma, ependymoma, cavernous malformation, syringomyelia, demyelinating disorders such as multiple sclerosis and neuromyelitis optica spectrum disorder. So what are the causes? Astrocytoma, ependymoma, cavernous malformation, syringomyelia and demyelinating disorders. So here also again gradual insidious onset, localized back pain. So here it will be a dissociated sensory loss affecting pain and temperature sensation. So here also there will be early motor weakness and early bladder involvement. So there in intradural extramedullary, late motor weakness, late bladder involvement, but here it will be early motor weakness and early bladder involvement. So summary, extradural lesions are outside the dura and usually present acutely with severe pain and early bladder dysfunction. Intradural extramedullary lesions are inside the dura but outside the cord, producing slowly progressive cord compression with a well-defined sensory level. Intramedullary lesions are in the spinal cord, cause dissociated sensory loss with early motor and bladder involvement. So this anatomical classification is fundamental for clinical localization and guides further imaging and management.